Welcome to City News. I'm Adrian Ghobrial. We begin tonight with news from Queen's Park that no one wanted to hear to start the new year. Schools, bars, restaurants, and much more will be closing as the Ford government tries to slow down a wave of COVID-19 set to sweep across the province.
We face a tsunami of new cases in the days and weeks ahead. Based on the current trends, our public health experts tell us we could see hundreds of thousands of cases every single day.
Premier Ford revealing today that 1% of all Ontarians infected by the new Omicron variant are expected to end up in hospital. If hundreds of thousands of people become sick each day, as this graph released by the province outlines, COVID-19 patients will overwhelm and exceed the capacity in Ontario's hospitals in the coming weeks.
As we do, virtually everyone in this province will know someone who has been exposed to this virus.
In an effort to increase capacity for COVID-19 patients which are set to arrive in our hospitals, all non-emergency surgeries will be paused for the next 21 days.
It's all about monitoring the impact on the healthcare system. Because this is so transmissible, passing so rapidly through our communities, that is the burden that we're trying to prevent.
As of this Wednesday, indoor dining at bars and restaurants will be closed, as will gyms and all indoor rec sports facilities. Social gatherings will be limited to 5 people inside and 10 people outside. Childcare centers will be allowed to remain open, as will malls, retail stores, and salons at a reduced capacity. However, families, students, and educators have once again been left scrambling. As of this Wednesday, all schools will pivot to virtual learning until at least January 17th.
These 2 weeks will provide much needed time for more vaccines, more boosters. It's more time for additional public health measures to blunt the rapid rise in cases.
Premier, when it comes to the school closures, let's say they are closed just for the next 2 weeks. Is there anything that your government can tell parents that they're going to actively do in the next 2 weeks to fortify our schools, to give them a fighting chance?
Well, first of all, I want to give a shout out to Minister Lecce. I always say he's the best Minister of Education in the country.
Premier Ford didn't answer our question other than to say the province will be delivering better masks for educators. So on behalf of families, City News asked a follow-up question.
Parents across the province have previously heard that schools should be the last to close and the first to reopen. Is anyone able to promise families across this province that schools will be reopened before any other business sector is reopened?
It's not just about making sure that the schools are safe. I think it goes hand in hand right across the board. When there's community spread,
we can assume they don't have an answer. There isn't an answer, or there isn't an intention, or the answer that they have isn't the one that they want to share. And when the answer is we're going to do as little as possible with schools.
Epidemiologist Colin Furness wrote an open letter requesting a 2-week delay in reopening schools after the holidays to allow time to prioritize vaccines for teachers and students and get high-quality masks, rapid tests, and HEPA filters into schools.
The question is, how do we respond in terms of protecting our healthcare system and being able to open schools sustainably? We can do it. We can do it in a few weeks, but we need to take the steps to make schools physically safe. The built form has to be safe. We're not doing it.
Furness adds that he and many other experts believe that some of these measures should have been put in place back in December, and they'll do little now to stop the tidal wave of hospitalizations set to hit the province of Ontario, which might leave many others without vital care. Now, if there's any hopeful message here today, Dr. Moore says that he believes this wave of Omicron COVID-19 cases may peak by the end of the month, and at that point, some of these measures may be able to be taken away.